to relax and learn medical, a place where curiosity meets calm. As soothing 432 Hz music plays in the background, it helps your mind and body to settle while you explore the fascinating inner workings of the human body. Here, we make learning effortless, enjoyable, and peaceful, like meditation for your mind and knowledge for your soul. Today, we go deep into a small yet mighty organ, the gallbladder. Often overlooked but vitally important, this tiny sac plays a big role in digestion, health, and balance. From its structure and function to surprising connections with your emotions, we're diving into 140 amazing facts that will leave you saying, "Wow, I never knew that." So sit back, breathe deeply, and let's explore the gallbladder like never before. 140 compelling and interesting facts about the gallbladder. The gallbladder is a small, pear-shaped organ located just beneath the liver. Its main job is to store and concentrate bile, a digestive fluid. Bile helps break down fats into fatty acids, aiding digestion. Your liver produces bile continuously, but the gallbladder stores it until needed. When you eat a fatty meal, the gallbladder contracts to release bile into the small intestine. The bile duct connects the gallbladder to the small intestine. The average gallbladder holds about 30 to 50 milliliters of bile. Bile contains bile salts, bilirubin, cholesterol, and waste products. Gallstones are hardened deposits that can form in the gallbladder. Over 25 million Americans are estimated to have gallstones. Many people have gallstones without any symptoms, called silent gallstones. Pain from gallstones is known as a gallbladder attack or biliary colic. Women are more likely to develop gallstones than men. High estrogen levels can contribute to gallstone formation. Rapid weight loss can increase gallstone risk. Obesity is also a risk factor for gallstones. The medical term for gallbladder removal is cholecystectomy. After removal, bile flows directly from the liver to the intestine. People can live without a gallbladder. After surgery, some may experience digestive changes, especially with fatty foods. The gallbladder has a mucosal lining that secretes mucus. Bile is alkaline, helping to neutralize stomach acid in the small intestine. Bilirubin, a component of bile, gives feces its brown color. Gallstones can be made of cholesterol, bilirubin, or a mix of both. The 4 F's for gallstone risk: female, 40, fat, fertile. The gallbladder doesn't produce bile, it only stores it. Gallbladder inflammation is called cholecystitis. Cholecystitis can be acute, sudden, or chronic, long-term. Gallbladder cancer is rare but can be aggressive. Symptoms of gallbladder problems include nausea, bloating, and pain after eating. Gallbladder issues are often diagnosed with ultrasound. MRCP, magnetic resonance cholangiopancreatography, gives a detailed bile duct image. A HEDA scan shows gallbladder function in real time. Bile reflux occurs when bile flows back into the stomach. Bile acids help absorb vitamins A, D, E, and K. Gallbladder removal doesn't stop digestion but alters bile flow. Bile helps eliminate excess cholesterol and toxins. Some people develop diarrhea after gallbladder removal. The gallbladder evolved to store bile for regular eating patterns. The gallbladder contracts due to a hormone called cholecystokinin, CCK. CCK is released when fatty food enters the small intestine. The gallbladder wall is made of smooth muscle. It has a narrow neck and a wider body and fundus. Bile emulsifies fats, breaking them into tiny droplets. The gallbladder works closely with the liver and pancreas. Biliary dyskinesia is poor gallbladder emptying without stones. Gallbladder sludge is a thickened bile that can lead to stones. Foods like beets, apples, and bitter greens support bile flow. Milk thistle is believed to support liver and gallbladder health. Artichoke extract may stimulate bile production. Bile is recycled. Up to 90% is reabsorbed in the intestine. The gallbladder can develop polyps, growths that are usually benign. Stress can affect bile flow by impacting digestion. Traditional Chinese medicine links gallbladder to decision-making. Emotional stress may contribute to gallbladder attacks. Gallstones can be as small as a grain of sand or as large as a golf ball. Gallstones can block the bile duct, causing jaundice. The liver makes about 500 to 1,000 milliliters of bile per day. Gallbladder flushes and cleanses are popular but not medically recommended. The gallbladder has no pain receptors, but nearby organs do. Gallbladder pain can radiate to the right shoulder or back. Fatty, greasy, and fried foods can trigger symptoms. Staying hydrated supports bile flow. Gallbladder problems can mimic heart attack symptoms. Chronic inflammation can lead to porcelain gallbladder, calcification. Porcelain gallbladder increases the risk of cancer. A high-fiber diet helps prevent gallstones. People of Native American descent are at higher risk. Genetics play a role in gallstone development. Hormone therapy and birth control pills can increase risk. Pregnancy affects bile composition and flow. The gallbladder has been recognized since ancient times. Hippocrates wrote about gallbladder disease. Gallstone surgery was first performed in 1882. Laparoscopic gallbladder removal became standard in the 1990s. Laparoscopic surgery reduces recovery time and scarring. The gallbladder is about 7 to 10 centimeters long. In Ayurveda, bile is linked to the Pitta dosha. Gallbladder attacks are more common at night. Low-fat diets can also cause sluggish bile flow. Gallstones can cause pancreatitis if they block the pancreatic duct. Bile helps prevent harmful bacterial overgrowth in the intestine. Gallbladder disease is more common in industrialized countries. Physical activity lowers gallstone risk. Coffee may protect against gallstones. Vitamin C is essential for converting cholesterol into bile acids. Apple cider vinegar is often believed to aid bile flow. Bile gives vomit a yellow-green color when reflux occurs. Chronic gallbladder problems can lead to digestive enzyme imbalance. The gallbladder contracts rhythmically in response to meals. Dogs and cats have gallbladders, horses don't. Astronauts have altered bile flow in zero gravity. Spices like turmeric may support bile production. Lack of bile leads to pale, fatty stools, stearia. Gallbladder removal is one of the most common surgeries worldwide. Bile salts are used in some medications and supplements. Fasting for long periods can reduce gallbladder emptying. Gallstones may pass spontaneously if small enough. The liver and gallbladder are closely connected by ducts and hormones. Gallbladder disorders may cause burping and bloating. The gallbladder is greenish due to bile color. Ancient medical texts sometimes misidentified its function. Ultrasound is the gold standard for diagnosing gallstones. Gallbladder pain can last minutes to hours. Some people experience phantom gallbladder pain post-surgery. The gallbladder may become infected, called empyema. Gallstones can cause infection in the bile duct, cholangitis. Some people are born without a gallbladder, a rare condition. Gallbladder disease can cause fever and chills. It's part of the biliary system, which includes ducts and liver. Gallstones can sometimes be seen on X-rays. Calcium stones show up more clearly than cholesterol stones. Gallbladder contractions are strongest after a fatty meal. Some medications can cause gallstones as a side effect. Estrogen dominance increases gallbladder disease risk. Sluggish bile flow can lead to toxin buildup. Certain antibiotics concentrate in bile. The gallbladder doesn't regenerate once removed. After surgery, the liver adjusts bile secretion over time. The gallbladder sometimes becomes twisted, volvulus, a rare emergency. Gallbladder removal can trigger IBS-like symptoms. The term, biliary, refers to bile-related structures. Gallbladder health reflects overall digestive wellness. Fermented foods support healthy bile production. Staying upright after meals can support gallbladder drainage. Bile acids also help control gut bacteria. The gallbladder is sometimes nicknamed the green sac. Some parasites can infect the bile ducts. Gallbladder cancer is more common in women. Most gallstones don't need treatment unless they cause symptoms. The gallbladder is innervated by the vagus nerve. Mindful eating can reduce gallbladder strain. Spinal misalignment may affect bile flow. The gallbladder may shrink or become scarred with age. Bile acids are used in some fat-soluble medications. Gallbladder problems can affect mental clarity and energy levels. Bitter-tasting herbs may stimulate bile flow naturally. Gallbladder flushes should only be done under medical advice. Regular meals keep the gallbladder active and healthy. A healthy gallbladder is essential for nutrient absorption and detoxification. As our journey through the gallbladder comes to a gentle close, remember, the more we understand our bodies, the better we can care for them. This little green organ may be small, but its impact on digestion, detoxification, and overall vitality is profound. Let the calm of 432 Hz music continue to resonate through your day, bringing clarity, relaxation, and new appreciation for the intelligence of your body. If you enjoyed this exploration, please like, subscribe, and share with someone curious just like you. Stay peaceful, stay curious, and always relax and learn medical.